Understanding asthma, a common respiratory condition. Asthma is a chronic respiratory condition. It affects the airways in the lungs. These airways are like tubes that carry air in and out of your lungs. In asthma, the airways become inflamed and swollen. This makes the airways narrow. It becomes difficult for air to move freely. Asthma is a common condition. It affects millions of people worldwide. Asthma can occur at any age. It often starts in childhood. There is no cure for asthma. However, with proper management, people with asthma can live normal, active lives. Recognizing the symptoms of asthma. Asthma symptoms vary from person to person. Some people have infrequent mild symptoms. Others experience frequent and severe symptoms. Common symptoms of asthma include wheezing, a whistling sound when breathing, especially when exhaling, shortness of breath, feeling like you can't catch your breath, coughing, especially at night or early in the morning, chest tightness, feeling like your chest is being squeezed or compressed. If you experience any of these symptoms, it's essential to see a doctor for diagnosis and treatment. Early diagnosis and management are crucial for controlling asthma and preventing complications. Causes and triggers. What sets off asthma? The exact cause of asthma is unknown. However, a combination of genetic and environmental factors is thought to play a role. Common triggers that can worsen asthma symptoms or cause an asthma attack include allergens such as pollen, dust mites, pet dander and mold, respiratory infections like colds, the flu and sinus infections, irritants such as smoke, strong odors and fumes, exercise especially in cold, dry air. Identifying your triggers is crucial for managing asthma effectively. Once you know your triggers, you can take steps to avoid them or minimize your exposure. Diagnosis and treatment. Finding relief and managing asthma. If you suspect you have asthma, see a doctor. They will ask about your symptoms. They will also perform a physical exam. To confirm the diagnosis, your doctor may order lung function tests. These tests measure how well your lungs are working. Asthma treatment typically involves avoiding triggers. Identify and avoid triggers that worsen your asthma. Medications. Your doctor may prescribe medications to control inflammation and open up the airways. With proper management, people with asthma can lead full and active lives. It's essential to work closely with your doctor to create an asthma action plan tailored to your individual needs.